How's it going, guys? Past level question for shock for cardiovascular step 1 internal medicine 2CK. 74-year-old woman found by the bottom of her stairs by her husband, demonstrates mild confusion. She reports left hip pain. Vitals are temperature 100.5 Fahrenheit, heart rate 100, respiratory rate 16, blood pressure 80 on 50. We have low cardiac output, normal PCWP, high systemic vascular resistance. Question wants to know what's the cause. Let's just hop through. Choice A, early septic shock, wrong fucking answer. We're always going to have low systemic vascular resistance in septic shock, whether it's early or late. That's how we know A and B are both wrong fucking answers. TNF alpha causes increased vascular permeability, vasodilation, decreased blood pressure. In early septic shock, we will see high cardiac output. In late septic shock, we can see a reduction in cardiac output. PCWP can be normal or low. Okay, so USMLE is not going to list as two answer choices, early versus late septic shock. I'm only doing this because I want to teach you, because on one of the NBME exams, they give you high cardiac output, low PCWP, as I said, it could be normal or low, and low systemic vascular resistance. The answer is early septic shock. They don't list late septic shock. But I'm just telling you because you'll see it on the NBME exams and wonder why they're saying early, okay? On USMLE, you're always going to choose high cardiac output and low systemic vascular resistance and normal/low PCWP for septic shock. As I already said, wrong fucking answers. Choice C, hypovolemia, correct answer. She has presumably a fractured hip with extravasation bleeding into the pelvis, causing the hypovolemia. USMLE likes this. Okay, now I'm going to address the elephant in the room. Some of you are going to say, but why the fuck does she have a fever? Okay, I've talked about this in my prior clips. It's called SIRS, Systemic Inflammatory Response Syndrome. So if you have a temperature less than 36, greater than 38 Fahrenheit, heart rate greater than 90, respiratory rate greater than 20, leukocytes less than 4, greater than 10,000. If you have 2 or more of those, that's SIRS. Okay, so that's systemic inflammatory response syndrome. You can see it in the setting of stress, acute distress. Okay, you could have toxic megacolon due to inflammatory bowel disease. You could have a perforated ulcer. You could have an autoimmune flare. You get sarcoidosis, SLE, and you're like, why the fuck is the temperature 101? Is she septic or something? No, it's just SIRS, okay? You'll see that more on 2CK questions, but I'm bringing this up because this isn't septic shock. Clearly the labs, clearly our parameters, we know for sure it's not septic shock. But then the temperature is clearly there, albeit low grade. It's from systemic inflammatory response syndrome, okay, acute stress here. So bleeding into the pelvis, you just need to know for USMLE, it's something that it's a cause of hypovolemic shock. They like it. And clearly we're going to have low cardiac output. We're going to have high systemic vascular resistance to compensate. If the heart's not pumping the way it should be, then we're going to have to compensate increased alpha-1 agonism by norepinephrine, epinephrine on systemic arterioles to constrict and in an attempt to increase pressure proximally. PCWP can be normal or low. Let's just hop to the final ones. Silent MI, wrong fucking answer. If we had a cardiogenic shock here, then our PCWP would be elevated. Okay, so this PCWP equals left atrial pressure. So any type of left heart pathology, whether it's an MI with overt cardiogenic shock, or even if the patient's not in shock, if you just have a mitral regurg where the patient's stable, mitral stenosis, aortic regurg, aortic stenosis, any left heart pathology can in theory lead to an elevation of pulmonary capillary wedge pressure. Wrong fucking answer. Choice E, spinal cord injury, wrong fucking answer. If we wanted to just state that this could be neurogenic shock, okay? Cardiac output would be low in neurogenic shock, but systemic vascular resistance is also low, okay? And then PCWP can be normal or low. Wrong fucking answer. You know the deal. To make more content, if you like my stuff, subscribe my channel. I appreciate your time. That's it.